Hi, everyone. It's Hal Feldman. I am here with Pinecrest Mayor Joe Corradino. It's time to get an update on what's going on with the county and with Pinecrest in relation to COVID-19. Joe, welcome. Thanks again for taking the time to talk to us.
Thanks, Hal. It's a pleasure again to be here. Hopefully we'll stop meeting like this for good reasons.
Exactly. Listen, I am tired of being inside. I'm playing the role of pretty much everybody that's going through this, and we all are. And I just got to get outside. Why do I need to put on a mask just to go outside? I'm not going into any stores. Tell me why we need masks outside.
We need masks outside because about the 98% of this disease is coming from community spread. It's likely that if you go outside, it's close to, we estimate close to 700,000 people in the county have this disease. So it's very likely, and it's very communicative, if you are outside, you're going to come into contact with somebody who may have this disease. And the medical professionals tell us that the number one way to stop the spread of this disease is to wear a mask. So we need to wear our masks. Absolutely. Right. Not forever.
This is an approved mask, right? You can't sit there and wear it like this or over your eyes or something silly. It's got to be on correctly for it to be effective, right?
It's got to be on correctly to be effective. Yes. And that's covering the nose and the mouth. And there's all a bunch of rules that people say about the mask and how you're supposed to touch them and stuff like that. We just need people to wear the mask. We'll get used to it. It's hard to get used to. It's uncomfortable, but it is the most beneficial thing that we can do as individuals.
Well, remember, if you're doing it, go ahead.
It protects the other people. It's not a seatbelt. A seatbelt protects you. This is like not drinking while driving, not texting while driving. This helps the person you're coming in contact with.
If you're doing this right, when you leave the house, nowadays everybody has their phone with them, and it really should be, two-handed. I got my phone and I got my mask. And if we can get into that habit, we should be able to really take care of this and knock us back down into flattening the curve or lowering it, correct?
That's absolutely true. The medical people we ask, should we close this? Should we close that? They say, no, wear a mask. If you wear a mask now, this will correct itself.
Okay, so listen, if I'm healthy, why do I care about what the ICU is happening, what's going on with our hospitals and crowding? Why do I care? I'm healthy. I don't think it's going to affect me. So correct my incorrect thoughts.
Well, this is probably one of the most communicable diseases that the nation has ever seen. So you could be healthy today, walk outside in the grocery store without a mask and catch this disease. And then you may need the hospital system. Now, our goal was not to eradicate the disease. Our goal was to maintain the capacity in the hospital system. Because when you lose capacity in the hospital system, what happens is that you start to store patients in the hallways. You start to have to ration care. You start to have to ration medicine. And what happens is that unnecessary deaths occur, right? Other people who would have otherwise survived are not able to get the critical care they need, and the mortality rate goes up. And we are just about in the position where we're going to lose the capacity of our hospital system. So let me just give you some statistics here. The ICU beds are about 106% occupied today, which means now they're rationing, now they're metering the people that go into the hospital. So what they're saying is they're not taking any more elective surgeries. You only get into the hospital if you need to get in, and you get out very quickly. So they have about 400 general purpose beds that they can convert to ICU beds. That's happening now. So, and again, there's probably only 400 and something people in the ICU beds now. So beds may not be the problem, but nurses are. We probably will need about 2,500 nurses over the next couple of weeks to get out of this. Drugs are the problem. We get 2 weeks supply of drugs every 2 weeks. The last one came in Saturday. It was gone by Tuesday. So
that's 4 days, Joe. 4 days for 2 weeks worth of drugs?
Yes. So we have supply chain problems in nurses and drugs. So we're reaching a critical mass.
I want to ask about, because you are thankfully privy to some pretty interesting discussions. You meet with a bunch of mayors and you have discussions to get status updates and to think about what policies are going to be effective. Can you talk to me about how much you as a mayor of Pinecrest, how much effect do you really have to the countywide program? And what do other mayors in the general area have in the way of effect toward overall policy making?
Well, specifically to me, specifically in the village of Pinecrest, I am going to be the chairman of the Miami-Dade County League of Cities. And so my role in that is to help coordinate all of the elected officials and the Miami-Dade County officials. And so fortunately, I've been one of the people who's been able to sit in on both meetings with the county folks and their health professionals and the big city folks and their health professionals. So I'm getting an understanding. This county's never been more coordinated. We have recently started meeting all the mayors in the county with the county mayor, consolidating the information, not having parallel sets of meetings, getting a playbook of common facts that we can all review, common data, common analysis, and then processing that to set policy. The hard part about this is, believe it or not, cities, this is a pandemic. It's a worldwide issue. In the United States of America, this should be led by the federal government. There should be one template given forth for how to deal with this disease, a set of best practices that you could replicate across the country. Look, even if it was done by the state of Florida, there'd be 50 of them. Right now, it's being done by local governments. There's 400 cities in the state of Florida. And that means there could be thousands of governments are going through these planning processes right now and inventing something that never has existed before, and it's all different, and it's confusing. So at least in Miami-Dade County, we're more coordinated than ever before.
So speaking of confusion, I don't think any people in general are, but can you tell me what the newest rules are so that we're trying to knock this thing down? And how quickly do officials think that this is going to actually help and be effective? And then what happens if they're not effective?
So a couple of weeks ago, we put in a curfew. We changed the rules on restaurants, no indoor dining, and we changed the rules on gyms, and there's a mandatory mask order. And those are the new rules. It takes about 2 or 2.5 weeks to start to see the impact of those things. So we have about another week to go before we see if we're going to be successful. By that time, if we don't see the numbers flattening out, we're going to have to take additional measures. What those measures are, we're debating right now, and that's going to be a difficult time. Now, we could be successful, but even if we are, the hospital system is rationing care. They expect that there will be 75% more people in the hospital. Right now, there's 2,000 people in. We'll get to about 3,500 people in the hospital, and this would peak in early August. And that's if we're successful. There's no guarantee of that, and we won't know if that's going to happen probably for a week or so.
Got it. And then we actually have talked offline. In fact, it was last evening I went out for a walk and I saw some activity that I didn't like and I was worried about. I ended up communicating that to you, and it was 12 people approximately. They were outside listening to some music, not being particularly loud or anything, but just the congregation of those 12 people in a parking lot was concerning to me. Can you tell me, has the Pinecrest police had any of these incidents? What's going on in people's backyards? Things that are still happening that you're concerned with, and what do you have to say to those people that are doing those things?
Well, our business community is complying very well. The people that shop in our retail stores and our citizens are complying very well. We've had very few instances at the stores where we've had problems. But I think the major problem was, and I'm hoping it's begun to tail off, but I'm not quite sure, are the private parties, right? The frustration is set in. Everybody's frustrated. Nobody can deal with this stuff anymore. But we're having private parties. The spread is coming from those parties. In fact, the spread is coming from inside your house now. So many people have this disease that when most people report where they got it from inside their home. Somebody goes out, they go to one of these parties, they spread it around, the kid comes back in the house, boom, the whole house is infected. Because 5 days before you feel sick, maybe 2 weeks, then you go to get a test, and then 2 weeks you get your test results back, but then your whole family's out. So these parties have to stop.
Well, obviously this is a very serious issue we continue to deal with. I think you kind of skirted this a little bit. I'm going to try to finish with something because I want to make sure that people understand how serious you believe this is. You had said that officials believe that with the new rules that are in place, that within the next week we should be effective. And then you said if we're not, you're going to have to go back and think about additional restrictions and things that you could do. But the word essentially dire comes to mind. If we don't get our act together in the next week, do you believe dire is a good word, or is that too strong? Or tell us what your personal feelings are on where we go if we can't get this thing capped in the next week.
Well, our main goal is not to overwhelm the hospital system, and the hospital people tell us that we are very likely to overwhelm that system if this doesn't work, what we've done the last 2 weeks, and we don't take corrective action soon after we know that it hasn't worked, that if we don't see this thing bend, we will be in a dire situation. And that means, look, man, the refrigerated trucks are coming back to the hospitals, right? This is a bad scene.
And it all takes this effectively happening with all of us citizens doing our little part to make this happen, correct?
It's that simple.
This is what you got to do, people. The mayor of Pinecrest is telling you what to do. He's making sure that the officials are doing what they're supposed to do and that the council is reacting to things as appropriate. So, Joe, thank you for what you do. I'm not going to end on something funny because this isn't funny. This is serious. Is there anything else we need to tell the people before we wrap this one up? Look, this is bad. It's a bad situation. It's not time to panic. It's time to put on that mask. That's all there is to it. Put on the mask. We know what to do. We did it in April. We did it in May, and it was successful. Just do that. We'll be okay. And if you need me, you want to yell at me, or you want to ask for advice, or you have a problem, call me. 305-606-2364. I'm always here. This is basically all I do right now. So we're here for you. To the entire council in Pinecrest, thank you. People, be kind to each other. And the way you be kind, once again, right here. Right. God, let's get over this. Joe, thanks again.
Hey.
Mayor of Pinecrest.
Stay well, sir.